Good morning, Camille and Jayne. Before we begin our session, I want to let you both know that this is a safe space where you can express any of your thoughts and feelings.
I'm very glad you mentioned that. For a long time now, my sister has been telling me to seek assistance with my problem. It just sunk in from last week that I need help. I know I need to fix this problem. I have been assessed by my doctor and dietitian for an eating disorder, but I still don't seem to accept the fact that I have one. I just think it's just a regular part of my diet and routine. Why can't people seem to understand that?
Thank you for sharing your concerns, Camille. It sounds like you really want to take care of your body, and that is great to hear. Just so I can get a better understanding about you, can you tell me about your daily routine? What do you do on a regular basis?
I wake up early to work out for an hour, and if I don't do my exercise well, then I work out for an additional hour. When I finish my workout, I eat breakfast and I take laxatives. Then I attend my online lecture for school. I work on my projects for school and I make sure to get in another hour of workout before dinner. Once I finish my exercise, I eat dinner and sometimes I take more laxatives before going to sleep.
Wow, Camille, it seems like you have a routine that keeps you busy. So you mentioned that you work out, you eat meals, and then you take laxatives. Can you explain the reason as to why you take laxatives after meals? Does doing this affect you emotionally in any way?
I have been using packs of laxatives hidden away in my bathroom to vomit after every meal. Ever since the beginning of the pandemic, I have been binge eating often. After I eat all of that food, I feel this wave of guilt overcome me, and I begin to have this need to rid my body of the food I ate. If you look in my room, there's a lot of empty wrappers and containers. I always eat there since I feel uncomfortable eating in the presence of others. When I am out in public, I drink water excessively. I want to lose weight, so I keep trying these new diets that I find in social media and the internet. I can't take it, seeing myself in the mirror every day, wearing baggy clothes to hide my body. It's so frustrating. It makes me feel worthless.
Camille, it must be extremely hard having those negative thoughts. What about physically? How do you feel physically?
Honestly, I've been having sleep problems. I have difficulties concentrating during my online classes. My fingers have so many cuts and calluses. My nails are so brittle and dry. I feel dizzy most of the time. I notice the discoloration of my teeth. I feel cold all the time. One time I just fainted after doing too much exercise.
Thank you for being so open with me, Camille. I appreciate clients like you and how you're willing to share your difficulties with having bulimia. Now that I have a better understanding of your daily routine and symptoms, we will now be able to focus on coming up with different interventions to treat you.
I want to help myself. I want to recover. So I need to be honest about everything.
Odirin, sorry to interrupt. So, I know Camille has bulimia nervosa, but what are the symptoms of it? How is it different from other eating disorders?
Jane, that is an excellent question. First, what I'll do is discuss with you the different eating disorders so you'll be able to differentiate them and you'll be able to understand about Camille's condition. Anorexia nervosa is when an individual limits their food intake to compensate for it through various purging behaviors. They have an intense fear of gaining weight even when severely underweight. Binge eating disorder: an individual may regularly and uncontrollably consume large amounts of food in a short period of time. Unlike people of other eating disorders, they do not purge. Because when an individual eats and craves non-food substances, this disorder may particularly affect children, pregnant women, and individuals with a mental health disorder. Rumination disorder can affect people of all stages of life. People with the condition generally regurgitate the food they've recently swallowed, then they chew it again and either swallow it or spit it out. Avoidant restrictive food intake disorder is an eating disorder that causes people to undereat. This is either due to a lack of interest in food or an intense dislike for how certain foods look, smell, or taste. For Camille's condition, bulimia nervosa, it is an eating disorder that is characterized by a cycle of binging, and compensatory behaviors such as induced vomiting, that is designed to undo or compensate for the effects of binge eating. Um, this behavior would include using compensatory behavior in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics or other medications, fasting, or excessive exercise. This binge eating and inappropriate compensatory behavior both occurs on average at least once a week for 3 months. And self-evaluation is unduly influenced by body shape and weight.
With all those symptoms he has shown over a year now, it really makes more sense now that she is really experiencing bulimia. But Odirin, how can I help my sister recover from this? I'm willing to do anything to support her.
Before our session today, I made sure to make a list of different interventions that could help your sister in her recovery from this condition. Camille, what I will now do next is explain some of these interventions that can help you deal with bulimia. Group therapy can be beneficial for your treatment. Using video conferencing, you will be able to connect with other people and hear their stories while also being able to share your feelings about this condition. And this will help you to understand more about your condition. If you have difficulty expressing your thoughts or feelings in a standard conversation, you can use journaling as a way to express those negative thoughts and feelings. You can also use it to track your meals every day. Also, performing arts and crafts can help provide a healing while serving as an outlet for your negative thoughts. Painting, sketching, or making bracelets can assist in turning your mind from a willful place to a willing and visual perspective towards what recovery may look like. Also, having a list or a plan before shopping trips will help you ensure what is only intended to buy, and you will not feel overwhelmed by the food choices. This is also cost effective. Learning to cook healthy and nutritious food is important for knowing how you can appropriately care for yourself throughout the recovery process. Finally, limit the use of social media and uninstall food apps. Doing this, it will help a ton. So avoid fat dieting trends and looking at models or celebrities, which can lower your self-esteem. Instead, you follow people that motivate you and make an impact on your recovery process. Uninstall food delivery apps like Uber Eats, Skip the Dishes, and DoorDash. Doing this will help you lessen the urge to order food on your phone.
It will take some time for me to learn and do all of this. I mean, everything sounds so interesting and good for me to try, but I'm kinda hesitant. What if the treatments fail to work for me? What if I start eating so much food again? What would happen to me then? I'm so worried about this.
Camille, I understand you feeling fearful and worried about not being able to overcome this condition, but that is why you are here. It is because you want to overcome bulimia and recover successfully. If you continue having bulimic behaviors, though, it can really affect your health. Purging by vomiting or laxatives depletes your body of important chemicals called electrolytes. The electrolyte potassium plays an important role in helping the heart beat and muscles contract, but it is often depleted by purging. Electrolyte imbalances can lead to irregular heartbeats and possibly heart failure and death. Binge eating can cause the stomach to rupture, creating a life-threatening emergency. Vomiting can wear down the esophagus and cause it to rupture. Also, frequent vomiting can cause sore throats and a hoarse voice. Extreme hunger or fullness at bedtime can create difficulties falling asleep and staying asleep. Low caloric and fat consumption can cause dry skin and hair to become brittle and fall off. If the brain and blood vessels can't push enough blood to the brain, it can cause fainting or dizziness, especially upon standing.
Thank you, Odirin. I didn't know about all these dangerous effects of bulimia. I really need to make an effort to stop this.
Othering, what are some other interventions that can help Camille's recovery? Is there something that I can do at home?
Well, Jayne, one thing that can be helpful for Camille is making environmental modifications in your home. For one, get rid of the scale. Weighing yourself, Camille, sets you up to create meaning out of something that is meaningless. Ditch the diet and junk food. Take the time to go through your refrigerator, freezer, and pantry to dispose of any junk food or diet products. They'll interfere with the recovery in a number of different ways. Create a positive setting for mealtimes. The goal is to create a space for meals that is welcoming, calming, and consistent. If you don't have a designated table space for meals, try to create one. Once you have established a positive and designated meal space, make an effort to eat meals there when you're home as opposed to sitting on a couch or in the bedroom. Recognize other items and settings that can be problematic around the house. Consider replacing triggering photos and pictures with happier and healthier experiences. It won't help to have exercise equipment that's constantly accessible in your house. Finally, organize the kitchen. Make sure that it is nutritious and make sure that appealing food is more accessible. Those are some of helpful environmental modifications.
Oh, Odirin, these points are very useful. I will implement them at home with Camille.
I'm glad to hear that. Before you go, I'm going to send you both a copy of the information that we discussed today during our session. Both of these handouts provide helpful information on how Camille can recover from bulimia and how you, Jayne, can support her on her journey. I'll see you both next week. Bye.
For being
Thank you
so
so
helpful,
much.
Odirin.
Bye.
Bye.